Glass, a pharmacy intern, presenting patient Sierra Urbana, a 60-year-old Caucasian female, with the chief complaint of "I'm ready for my next step in my cancer care." Her history of present illness: she was diagnosed with early stage non-metastatic breast cancer in November of last year after a routine mammogram. She has completed chemotherapy and is ready to start hormonal therapy. Her past medical history includes breast cancer and a DVT 3 years ago, and she had a lumpectomy November last year. Her family history includes her mother having breast cancer. She is a non-smoker and does say that she drinks 4 glasses of wine per week. She has no known allergies. Her medications include amlodipine 10 milligrams, taking 1 tablet by mouth once daily, fluoxetine 40 milligrams, taking 1 capsule by mouth daily. All of her immunizations are up to date. She's positive for fatigue, myalgias, and arthralgias. Her blood pressure is 128 over 74 millimeters of mercury, a heart rate of 74 beats per minute, a temperature of 98.8 degrees Fahrenheit, a respiratory rate of 16 breaths per minute. She is 66 inches tall and 136 pounds with a BMI of 22 kilograms over meter squared. Her laboratory and diagnostic tests: she does have an ejection fraction of 55%, and her creatinine clearance is 64.9 milliliters per minute. The problem is that the patient has completed chemotherapy and she is now ready to start hormonal therapy. So based on the 2020 NCCN clinical practice guidelines and oncology for breast cancer, it does recommend adjuvant endocrine therapy for postmenopausal women at diagnosis and to start aromatase inhibitors for 5 years. This is a Category 1 recommendation. Aromatase inhibitors indicated in hormonal treatment for postmenopausal women with breast cancer do include anastrozole, letrozole, and exemestane. All 3 regimens are dosed once daily and are oral therapies. There are no drug interactions with the patient's current medications, and all 3 options are recommended by the NCCN. The patient already has hypertension, so the risk of exacerbating that is higher in the anastrozole, so I would recommend using letrozole 2.5 milligrams by mouth daily. The goal for this problem is to have no reoccurrence of the breast cancer or disease progression, so I recommend starting letrozole 2.5 milligrams by mouth once daily, and we're going to do this for 5 years. For safety monitoring, we want to make sure that the patient doesn't have any joint or muscle pain or signs or symptoms of osteoporosis. And for efficacy, we want to make sure that the patient doesn't have any reoccurrence or disease progression with her breast cancer. So what questions do you have for me?